mynews.studio.
Picture this, a vial of synthetic blood next to a simple test tube, tools that could let us spot Alzheimer's years before anyone notices symptoms. Are we really at the point of changing what medicine looks like?
Today is July 20th, 2025. Let's dive in. We've got two things to unpack here: new blood tests and artificial blood. Where do we kick off?
Diagnostics is a good place to start. Here's the headline. Blood tests are now picking up diseases like Alzheimer's and multiple sclerosis much earlier. For Alzheimer's, there's a test, the Lumipulse GP-tau 217/beta amyloid 142 plasma ratio. It just got FDA clearance. It measures specific protein ratios in the blood, and that can reveal Alzheimer's years before symptoms appear.
Years ahead of symptoms? That's significant. Does this mean people could be treated before they'd have any clue they're sick?
Yes, that's exactly the point. Early detection lets doctors start therapy sooner. In Alzheimer's, that could mean slowing cognitive decline, helping people keep their independence for longer. Instead of losing function over 5 years, it could stretch to 8 years with more stability.
And for multiple sclerosis, same idea?
Pretty similar. The new blood tests can identify which MS subtype a person has and track how well treatment is working, basically in real time. That means doctors can quickly adjust therapies, which reduces the chance of lasting neurological harm.
So, practically, are we talking about fewer hospital stays, less financial strain for families?
That's the aim. Early, targeted intervention means less long-term care, a slower rise in disability, and lighter pressure on both families and healthcare systems. It's a shift in how chronic diseases are managed worldwide.
But what about actual access? How quickly will these tests reach people outside the US or Europe? Can patients in low-resource settings benefit?
The Alzheimer's blood test is already rolling out in the US this year, with insurance covering it. Other regions are moving at different speeds. The main barrier is infrastructure. Labs, trained personnel, even insurance systems. So the science is ready, but making sure everyone benefits is still a challenge.
All right, let's switch gears. Artificial blood. This used to sound like science fiction. Where are we now?
It's not fiction anymore. Japan starts clinical trials this year, aiming for real-world use by 2030. In the US and Europe, teams are making blood substitutes from stem cells and molecules. The goal is blood you can store at room temperature, give to anyone, and use in emergencies.
That could be a game changer in remote locations or conflict zones. But is it safe? What are the main risks?
Safety's a big issue. There are worries about immune reactions and unknown long-term effects. Getting regulatory approval takes time. Trials have to prove these are as safe and effective as donated blood. And then there's the cost. Lab-grown blood is expensive and needs specialized facilities.
And if we're talking logistics, distribution, storage, making sure staff are trained, how are health systems getting ready?
A lot of systems are still figuring it out. Bringing in new diagnostics and synthetic blood means updating clinical protocols, training staff, and expanding lab space. Some places don't have the labs, the cold chain, or even enough trained people. Plus, there are ethics to consider. Handling early diagnoses, privacy, and deciding who gets access first in a crisis.
So we're heading toward a future with faster diagnosis and more personalized treatment, but access and ethics are the sticking points?
That's the crossroads. These advances could change global healthcare if we tackle the barriers. Early detection and synthetic blood could save lives and improve quality of life, but only if systems are ready and access is equitable.
And are there risks we haven't covered yet? Like, could knowing you have a disease years early actually do more harm than good?
That's a valid worry. False positives or negatives can cause anxiety or give a false sense of security. Learning about early Alzheimer's with no symptoms can be distressing. So counseling and informed consent are essential. And with artificial blood, we'll need long-term safety data before it's widely used.
Are official bodies stepping in to set standards for counseling, consent, insurance?
Yes, but it's a work in progress. Professional groups and governments are developing guidelines for everything from consent and counseling to training and coverage. Technology is moving fast, so policies need to keep pace. It's an ongoing process.
Final thought. Are we really on the edge of a new era in medicine, or is there still a lot of hype?
The science is strong and the potential is there. If we solve the access and ethical issues, these advances really could reshape healthcare around the world.
Early detection, synthetic blood, and a future with faster, more precise care. Are we prepared for it? That's the big question.
Thanks for joining us as we explored how a test tube and a synthetic blood bag might change medicine's future.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now, free of charge.